Good morning. This is Dr. S. Prince Samuel, working as Assistant Professor in the Department of Biomedical Engineering at SNS College of Technology, Coimbatore. SNS College of Technology is the first Indian institution to implement the design thinking framework in the entire curriculum. In today's class, I am going to briefly explain about the fundamentals of telehealth technology, the basic fundamentals of telehealth technology. So, when we speak about the fundamentals of telehealth technology, you should know some of the basic biomedical physical parameters. So, what are the basic parameters of the human body? What are the most important parameters of this human body? What are the life-saving devices available in the market? What are the devices which are very useful during pandemic times? What kind of instruments can be used during this natural disasters? These are like different areas we should focus on before going into the fundamentals of this telehealth technology, because the fundamentals of this telehealth technology comes within the combination of medical plus instruments, that is medical sensors plus the biomedical factors. So here the core telecare technologies means initially we speak about the smart home devices. So sensor here, smart home devices means the first and foremost important term is nothing but this sensor. So there are different types of sensors available in the market for different purposes. Among the sensors, there are analog sensors, digital sensors, etc. So definition of sensor is nothing but it is capable of capturing some information, process the information and gives the output. This is called as sensors. For example, a sensor it is used to detect the heart rate. There is a sensor used to detect the motion level. There is a sensor used to detect the fire alarm. Likewise, different categories of sensors are available depending upon the location and depending upon the type of purpose for which the sensor is to be used. And among this, there is an advanced type called the smart sensors. Smart sensors means it is capable of storing the information on its own and retrieving back. So the sensor generally combines with some kind of microcontroller. In this picture, you see this smartwatch. This is a watch which is giving the basic necessary function, and additionally the parameters are monitored and stored in this watch. This is called as smart sensors. So this all begins with the fundamentals of telehealth technology. There are many more life-saving. This small example is nothing but this smartwatch, the emergency systems. Among these technologies, now we integrate the platform of AI and power analytics to become the sensors more accurate, more easy to use, to make the sensor store more data more accurately without malfunction. Likewise, different advancements have to be made to predict the more analysis, to predict what kind of disease will occur to the same person even after 5 years. Likewise, in those conditions, this AI platform plays a vital role. This is called as integrated AI systems. So the AI and the biomedical sensors, they combine together, they do the process, and finally the output is being sent. So in this slide, since the first unit is purely dealing with the basics, the fundamentals, the natural scenarios. First, you have to understand the basic scenarios, different situations. Then later on, we can go to the upgrading stage. For example, here in this slide, first and foremost, let us discuss about the aging person, the elderly people, the GTL doctors. They deal with the how to monitor them. They will be having memory loss, dementia, likewise different cases are available. How to monitor them is the first and foremost thing in this thing. How to monitor those kind of people. So how to treat these elderly people? They cannot stay always in the hospitals also. So sometimes it will be a prolonged, even they will be living up to 6 to 12 months, but with some kind of irregularities in the human body. So how to convert the home into a hospital using some kind of sensors to make it more easy for the patient attenders as well as the patient. So it is an empowered self-management, how the patients receive the real-time data, personalized health insights. At the same time, the 4 and 4 increased efficiency. So 24 into 7, monitoring is very needed in those kind of situations. Continuous monitoring is needed without human intervention. Then only the some characteristics of individuals can be studied easily. The doctors also will be able to prescribe the medicines according to it very easily. So the provider message cost savings, the operational efficiency, proactive care, and the fourth one is having data driven decisions. So TKL virtual check-ins, remote monitoring, medication management, emergency alert systems. This is the case studies of different hospitals. So our aim is nothing but to make the solutions, to provide the solutions in a better way. At the same time, all the safety parameters, regulatory standards have to be maintained, data privacy, data security, etc. So the future of telehealth model is mentioned the AI predictive analysis and the preventive focus, personalized and seamless integration. Thank you.